Hi guys, Dr. Sam here.
Dr. James, welcome to our weekly live. Today we want to talk to you a little bit about how chiropractic might be able to help with our osteoarthritic conditions.
So what we have in data, we have knee and hip arthritis as a 12th leading cause of disability globally. And what happens is we see countries like Canada alone, they have 4 million people that have or suffering in osteoarthritis, and also they have 120,000 people that have had some sort of knee or hip replacements every year. So what happens is we know there are two organisations. They spend a lot of research around osteoarthritis. Osteoarthritis Research Society International and American College of Rheumatology, they have updated their new guidelines into how to self-manage osteoarthritis or some sort of a non-surgical option, how to manage that at home or yourself. So they recommend exercises, they recommend weight loss, but during their guidelines they did not recommend manual therapy. But there is something new, Dr. James.
Yeah, so despite this, manual therapy, which is what you would find with chiropractors, physiotherapists, things like that, there is actually some information coming through for it. So the National Institute of Healthcare Excellence actually found that there is actually a lot of potential for manual therapies within it. And now there's been a couple more studies done, again in more recent times as well. One review was looking at how there was an increase in physical function, a decrease in pain for both short and long-term impacts for people with osteoarthritis. And there's also an RCT done, which is a randomized controlled trial. So it's really, really powerful stuff where they found consistently benefits with manual therapy in things like pain, function, range of motion, and physical performance. So what this leads us to think is that as always, we need that little bit more research to actually flesh out how manual therapy has a role within osteoarthritis. But it tells us that yes, there is a place for these things, and it's just a case of figuring out how best we can work with it. So ultimately, we suggest, if you are struggling and you've tried a few other things, give us a call, come in, let's see if there's something that we can do to help with increasing your daily function or your range of motion. So yeah, please give us a call and see what we can do for you.
Alright, bye guys, have a nice weekend.
See ya.